for someone listening to us, she has a cream and she doesn't even know what to look out for. Okay, so why should this cream be bad for me? Why shouldn't I use it? What would you advise? What are those chemicals? What are those substances that when you see them in your cream, you are supposed to run away? They shouldn't even be on your skin at all. Could you help us break it down so those people listening right now could know that when I see this must not come on me?
Okay, so this is very difficult, and I'll explain why. In Nigeria, a lot of people produce creams and don't actually disclose the contents. There are many studies that have shown that even creams that do not have, they do not disclose on the label that they contain dangerous substances like mercury, like high levels of hydroquinone or corticosteroids. These substances are the top 3 things that are used for skin lightening in our environment. And you find many people, many creams that actually have these substances, they are not being disclosed. The people who create them do not disclose on the labels that these substances are present in the creams. And that is a major problem because people will go out buying a skincare product thinking, oh, it's safe or it doesn't have any lightening agents, and they use them. And unfortunately, they end up using something that has a dangerous product. So let me talk about the 3 major things that are used for skin lightening in the environment and why we advise people not to use them. The first one is hydroquinone. Hydroquinone is actually used by dermatologists in some parts of the world. In some areas, it's banned, like in Europe. But in America, in Asia, and in Africa, it's allowed in small quantities. Hydroquinone is a very, very effective skin lightening agent, but it's not meant to be used for long periods of time, and it's not meant to be used without a prescription. So it's like a prescription medicine. Our prescription medicines are usually used for short periods of time. Maybe the doctor would say use it for 6 weeks or 8 weeks and stop. And it's not for the whole body. It's usually used to treat a particular skin lightening issue. But in our environment, we have people using it, they use it for long periods of time. And then it can come with a lot of side effects and also at very high strengths or high concentrations. And this is unacceptable. So that's one thing. So hydroquinone, and then it can cause this very horrible, ugly discoloration of the skin when it's used for long periods of time, particularly without sunscreen in an environment like Nigeria where we have very high UV intensity. The sun is very hot. So people will rub hydroquinone all over their body without sunscreen and go out into the hot sun. It's ridiculous. Now, the other thing is steroids. And this steroids, corticosteroid, this is the major thing that we believe a lot of these so-called organic creams are using. They contain these corticosteroids or topical steroids. Steroids, as you know, as a doctor, they are used to treat inflammation of the skin for a short period of time. We may use a steroid for just a week or 2 and stop. And that's because long-term use of steroids will damage the skin, will cause the skin to become thin, will cause the skin to develop, become very transparent. So that's when you see people saying they have green veins. It causes red skin thinning. It can reduce the skin's ability to fight infection. So any fungal or bacterial infection that comes on the skin will become exaggerated because the skin's natural immunity has been suppressed by the steroid. It can also cause stretch marks. So you have stretch marks like that and so many other things. Then steroids are also absorbed into the bloodstream through the skin. And a lot of steroid use can actually result in high blood sugar, high blood pressure, and what we call Cushing's syndrome, which is an excess of a hormone called cortisol, exogenous cortisol or excess of cortisol in the body, which can lead to a myriad of problems: weight gain, depression, high blood sugar, as you mentioned, high blood pressure, and so many other terrible things. And we've actually seen people developing Cushing's syndrome from using Dermovit cream, which is a very potent steroid. Now, a lot of these organic creams that are so-called organic, because there's nothing organic about them, contain these steroids, because when people use them, after 3-4 months, they start developing the side effects of steroid use. And that shows that because of the lightening effect of steroids are not primarily used for skin lightening, but the side effect because they inhibit the melanocytes. So the melanocytes, that's the cells that produce the color of the skin. They have a way of preventing them from producing melanin. But the side effect, it's not the real effect of the steroid. So a lot of these creams contain these steroids. A lot of people mix steroids into their cream. A lot of people even mix for their children. They will buy from Bact-A, Skinil, and a lot of steroid-containing triple action creams to mix with their baby's cream because they realize that the cream can make their children lighter. It will also initially make the skin very smooth because it's an anti-inflammatory cream. So, unfortunately, nobody will come out to say they are putting steroid in their cream. So even if they read the label, it won't be there. So that's the challenge we're having. People are being deceived by a lot of skincare vendors who claim they are creating organic creams and soaps, but they are using very strong chemicals. Then the last one is mercury. Now, mercury is not as common as before, but mercury, as we all know, has terrible effects on the kidneys, can damage the kidneys, can also damage, the brain and the nervous system, can even cause people to become depressed and psychotic. And after a while, I began to think that a lot of women that are having psychotic episodes as of lately or of unusual behavior, maybe we should do a study to see if they are using lightening creams containing mercury. And their behavior may actually be linked to, the creams they are using. Because we see a lot of people in the media these days having psychotic breakdown, I begin to wonder if there's a correlation or an association. But it's possible. It's very possible. A study was done in India, and that study showed that all the women who using mercury-containing lightening creams, they had some degree of neuropsychological disorder, ranging from anxiety to depression to suicide ideation. So it's actually possible. It's just that we haven't studied or we haven't looked at it in Nigeria. But mercury is also used for skin lightening. In fact, there are some soaps that are on the market today that still contain mercury. And I remember making a complaint on Twitter that why would agencies allow mercury-containing soaps to still be sold? So mercury, hydroquinone, and steroids, these are three major skin lightening agents that are used in creams and people should avoid. Now, in Nigeria, 2% hydroquinone is acceptable for some lotions, the maximum of 2%. But we find that even some creams that claim they have 2% hydroquinone, when they were tested in other areas, they contain up to 10% of hydroquinone. So it's advisable that people don't even use anything. And so what I tell people is that any cream that says whitening, lightening, brightening, glowing, fair, white, half-cast cream, mulatto cream, gold, skin gold, any cream that has any of those adjectives, just avoid them because you don't know what is inside them. And these people are not being honest about what they are using for these creams. So all this whitening, 7 days whitening, anything that will whiten your skin in 7 days is dangerous.